Hi, my name is Angela Smith. I'm doing this video for Adult Health 1 for Professor Lukowski's class. This is the Piggyback demonstration video. So the first thing I'm going to do is verify the MAR and the doctor's orders, which in this case, this is for our patient Mr. Jones, and the doctor ordered ordered Flagyl, 500 milligrams every 6 hours to be infused over 60 minutes. When you do the math, the calculations works out to be 17 drops per minute, as you can see. And so what I'm going to do is get my bag prepared first. I'm going to draw up my Flagyl. So clean the top of the medication and okay. Alright, I'm going to clean the port on my bag. And I would have also verified his allergies in the chart to make sure he's not allergic to this, which he's not, but I will also ask the patient. So, inject the bag with the medication, and it is. So, now, alright, so I'll dispose of that in a sharps container. Alright, I'm going to go ahead and mix my bag, label my bag, okay, grab my tubing. I'm going to also label my tubing with the date and the time, and I'm going to go ahead and drop the primary bag down, okay, spike my bag. Turn my clamp off first, squeeze, spike the bag. Alright, squeeze it again, it's about halfway full, that'll work. Hang my bag again. I'm going to unclamp it. Let this run through. Good, okay. So, I'm going to go into the room, introduce myself again. Mr. Jones, my name is Angela, I'm your nurse. Like we discussed earlier, you may need some more medication. I'm going to perform hand hygiene first and apply my gloves, and we're going to discuss the medication. So I need to know what your name and your date of birth is so I can verify this is the right patient.
Tom Jones, 12255.
Okay, good. And that matches my records. Okay, so Mr. Jones, this time Flagyl was ordered 500 milligrams. You'll be getting this every 6 hours, and it will be given over a total of 60 minutes. Have you ever had Flagyl before?
Yes.
Okay, do you have any allergies to medications?
Nope.
Okay, good. No allergies. So, and you've had this before, so we still have to go through some of the things in the medication just so you're aware of it this time again. It's Flagyl, and adverse reactions would be seizures. We're going to monitor for dizziness, headache, and nausea just like the previous medication, but we're going to look additionally for abdominal pain. That's the difference between the two. This disrupts the DNA and protein synthesis, and it is a bactericidal medication. Okay, and this is for your H. pylori that's in your stomach. Okay, so I'm going to assess this site here, and I'm going to make sure that we have a good looking site and that it's patent, and we have a primary bag that's currently running. And the site's nice and clean. There's no redness, no swelling, no signs of infiltration. So the next step I'm going to do is clean the port hub. Okay. Alright. And nice and clean, I'm going to connect my Piggyback. And the clamp is still off, so nothing's running yet. Okay. And I'm going to go ahead and turn off my primary bag. Okay, that's turned off. And now I'm going to go ahead and open my Piggyback, and I'm going to calculate it 17 drops a minute, which is about 8 drops over 30 seconds. So, okay, that's about right. And that clamp is, so primary's clamp is closed, my Piggyback is open, And my site's flowing at the correct rate. And recheck my site again, it still looks good. No signs of infiltration. Okay. And basically I'm just going to hang out with the patient for the next 15 minutes, make sure we don't have any reactions, and this is given over a total of 60 minutes again. So, okay, so everything's infused. Periodically I've come back in and checked on the patient. We've had no signs of adverse reactions, no abdominal pain, any vomiting, dizziness, rashes, anything like that. So it's been a full 60 minutes, and we're going to go ahead and discontinue this again. So, Mr. Jones, how have you tolerated the procedure and the IV fluids, medication?
All right.
Okay, good. So this time I'm going to do hand hygiene again. I'm going to apply my gloves, and we still have no signs of allergic reaction. First thing I'm going to do is I'm going to clamp off my piggyback, okay, and then I'm going to open up my primary, okay, and that's running again. And now that my piggyback is still clamped off, I'm going to discontinue this, okay, and I'm going to hang it so I can reuse it again. And I'm going to reestablish, make sure that the primary is at the correct flow rate that the doctor has ordered previously. Okay, which it is. And I'm going to bring it back up here again. Let gravity help it. Verify my site still looks great, no signs of infiltration, and patient tolerated the procedure well. Doing okay, Mr. Jones?
Yep.
No complaints, no problems. All right, good. So I'm going to pull my gloves off, hand hygiene, and I'm going to go back and I'm going to document, the medication that was given, the dose, the route, the amount of fluids that were given, or the amount of medication in the IV bag, the site, and how it looked, which was nice and clean, no signs of infiltration, no redness, no swelling, and how the patient tolerated the procedure, which was well, no complications, no side effects, no allergic reactions. And then I would just come back and check on them periodically, make sure that we don't have any long-term side effects or adverse reactions. And that's it.